Good morning. My name is Dr. Chad Perlyn, and I'm a pediatric plastic surgeon at Nicholas Children's Hospital in Miami, where we have one of the largest programs in the country for taking care of children with Beckwith-Wiedemann syndrome. I'd like to talk about two questions that parents frequently ask us. The first relates to the swelling of the tongue, and the second relates to whether the child will grow into the tongue. With regards to the first question, the enlarged tongue in children with Beckwith-Wiedemann syndrome is actually not swollen. It's enlarged or hypertrophied, which means there's overgrowth of the tongue structures. So, unlike other conditions like an allergic reaction where there's swelling, or a trauma where the tongue gets enlarged and has a chance to decrease in size as the fluid goes out and the swelling decreases, in Beckwith-Wiedemann syndrome, it's a different situation. There really is no swelling, and therefore the tongue size won't decrease on its own. With regards to the second question, and this is a really popular question, and it's a good question, will the child grow into the tongue? For many years, when physicians and families were first starting to understand Beckwith-Wiedemann syndrome and understand the relationship of the tongue to the jaw, there was a thought not to do anything for the tongue, not to do tongue surgery, because the tongue would fit into the mouth. People would say, well, let the child get older, and you'll see the tongue will fit into the mouth. Unfortunately, what happens is the tongue will fit in the mouth over time. If tongue reduction surgery is not done on a child with a very large tongue, we will see that that tongue will start to fit into the mouth. But it does so at the expense of the lower jaw. When we bite down, our top teeth should come in front of our bottom teeth. But in a child with Beckwith-Wiedemann syndrome who has macroglossia, who has an enlarged tongue, that tongue acts like a piston, constantly pushing forward on the lower jaw. And over time, that lower jaw expands and actually comes forward so that the bottom teeth wind up in front of the top teeth. And we can have a significant open bite or cross bite and real jaw deformity as a result of that. In some children, that jaw deformity can become so severe that the only way to correct it later in life is with jaw surgery to actually cut the jawbone and move it back. The second thing that we see is that the tongue does fit into the mouth over time as many children get older because they learn to hold their tongue in the mouth. And one of the interesting things when we talk to older children who had not had a tongue reduction in early infancy, many of them say, yes, they do learn how to hold their tongue in their mouth, but it's a conscious effort. And some of them come and say if they're on a date or studying for an exam and they're not concentrating on keeping their tongue out of their mouth, the tongue does come forward. So those are two issues which really explain why the child does not grow into the tongue, or the opposite, why the tongue doesn't grow into the child. Yes, over time, the tongue may fit in the mouth. But again, it happens at the expense of the lower jaw, and it requires concentration on behalf of the child. Doing tongue reduction surgery, particularly early in life, resolves both of those issues. And it's why the data has been so important and shown that this is such a successful operation that really changes children's lives. Please don't hesitate to ever contact us if we can ever be of assistance. Thank you.